Now, on to more of the patient side. You know, waiting rooms tend to be petri dishes, to put it, bluntly. What steps can a physician leader do to not only protect their patients in the waiting room or avoid the waiting room, but also to sort of mentally keep them from being concerned about that experience?
Yeah, and in one of our papers, we wrote about the physician-patient interaction. The healthcare facility is like a small, town, a small labor force, a small factory. And you can have harassment of patients from the physicians, harassment of physician to physician, and the harassment from patient to physician. So there are three types of, miscommunication, harassment incidents that happen. So one, you have to know and maintain that you are here for the good of the patient. And these people could be frustrated, they're not well educated, they don't have the knowledge, the awareness. So you have to be kind and compassionate to your colleagues and your patients. And many times the patients are frustrated because they're anxious, they're waiting on tests, and they may engage in behaviors that you may find abnormal. But I think the good thing here is, again, when earlier we thought, what's the need to post a flyer? Now is the time to post those flyers on hygiene, sanitation, social distancing. Everything that happens in a facility should be known to all based on good clinical practice and appropriate protocol. If the patients have to know that they have to distance themselves from each other and use some common techniques like coughing and covering their face, use a sanitizer that's available. Don't overcrowd the waiting spaces. If you are finding less space, go out and sit in your car or go take a walk in the meanwhile. And those are things that the facilities have to do to educate the patients. When you see the waiting rooms, there are chairs and chairs in alignment. Ensure that not everyone is in the same row. Change the rows of where people are seated. So, there are some basic techniques that can be used to ensure that everyone is 6 feet apart and knows how to behave in these times. Make sure that you go into detail, like I just wrote for a magazine, that there are some behaviors that we cannot accept as cultural anymore. We cannot tolerate certain types of behaviors just because we are a diverse society. No one should be coughing in open without covering their face. No nail biting, no thumb sucking, and no throwing of gloves and masks. Those are things that you should warn people about, educate them about. And this is also the time for physicians to educate their staff and patients. Even if it sounds rude, you have to educate them that we have certain protocol in this facility and you have to follow that protocol. We are trying to help you to the best of our ability, but you have to cooperate.